Hello everyone, my name is Cyrille Touzeau from the University Hospital of Nantes in France. I have presented on behalf of my colleagues the results of the 2018-04 IFM study dedicated to newly diagnosed myeloma patients that evaluated the combination of daratumumab, carfilzomib, lenalidomide, and dexamethasone in the specific subset of high-risk myeloma patients. So as you know, high-risk cytogenetic is associated with poor outcome in transplant-eligible myeloma patients. We know that KRd, carfilzomib, lenalidomide, and dexamethasone works very well in newly diagnosed myeloma patients, and especially in high-risk patients. We also know that the addition of daratumumab considerably improve PFS and response rate in newly diagnosed myeloma patients, and we know that with the Cassiopeia and Griffin trials so far. And recently, tandem transplant has been shown to improve the outcome of high-risk newly diagnosed myeloma patients, and this data has been brought by the EMN02 and Stamina trials. So with the IFM group, we propose to high-risk newly diagnosed myeloma patient with high-risk cytogenetic, T414, 17p deletion, TIN1416, an intensive strategy that combine daratumumab, KRd, 6 cycles as induction therapy, autologous stem cell transplant number 1, consolidation with 4 cycles of Dara-KRd, second transplant, and the maintenance combining daratumumab plus lenalidomide during 2 years. So this is the patient characteristics. 50 patients have been included in the study, median age 57. All patients had revised ISS score of 2 or 3, and based on inclusion criteria, all patients had high-risk cytogenetic, 70p deletion in 40% of patients, T414 in 52% of patients, and T1416 in 20% of patients. We also looked at the presence of 1q gain that was present in 50% of patients, and it is interesting to know that almost 2/3 of patients had at least 2 high-risk cytogenetic abnormalities. So this is a treatment disposition. Most patients, 72% of patients, for them the treatment is still ongoing, and 14 patients discontinued treatment so far. I will focus the presentation of the result of induction. All patients completed induction. Safety first. The treatment was well tolerated with grade 3-4 adverse events that were mostly hematologic events and low rate of non-hematologic grade 3-4 events. We noted, of course, no grade C4 cardiac event and a very low rate of renal failure. 2 patients should discontinue treatment due to adverse event, a COVID-19 infection in 1 patient, and a tumor lysis syndrome in 1 patient. One important point was stem cell collection. Initially, stem cell collection was performed after induction, after 6 cycles, and for the 27 patients that had stem cell collection after 6 cycles, we had 6 stem cell collection failure. The study protocol was therefore amended to collect stem cells after cycle 3, and 21 patients had stem cell collection after 3 cycles, and the median CD34 positive cells rate was higher, 8.3 as a median, and we had no stem cell collection failure for these patients. Now, efficacy. The response rate was nearly 100%, 96% in this population of high-risk patients, with 31% of CR or better and 91% of VGPR or better rate. MRD negativity has been assessed by NGS, and at the threshold of 10 to the -5, 62% of patients reached MRD negativity at the end of induction. The median follow-up is still short, 19.4 months, but the PFS and overall results are so far excellent. So to conclude, this phase 2 IFM study 2018-04 confirmed the great efficacy and the feasibility of the quadruplet induction Daratumumab-KRd in this population of high-risk transplant-eligible patients. No new safety signal was observed with this quadruplet induction. We have to notice that in this context of anti-CD38-based quadruplet induction, stem cell harvest should be performed after 3 or 4 cycles to limit the risk of harvest failure. Dara-KRd induction induced high deep response rates and high rates of MRD negativity, but a longer follow-up is needed to determine the efficacy and the feasibility of the overall therapeutic sequence, including double transplant consolidation and maintenance. Thank you very much for your attention.